Hi, my name is Tara Gazda, and I am the Family Support Coordinator in the Worcester PAL office. Today I'm going to talk to you about different levels of care. We're going to start with the very basic outpatient therapy. That is your individual therapy. You go weekly, every other week, once a month. You sit with your therapist 45 minutes to an hour, and you go home. That is your outpatient therapy. We have in-home services. Those are your intensive care coordination, in-home therapy, in-home behavioral services, and family support and training. Often referred, you'll hear them IHT, ICC, IHBS, and FS&T. Then we have our mobile crisis. You call them, obviously, when we're in a crisis situation, and they may do an assessment and determine a higher level of care is needed. The very basic one at that point is your partial hospitalization program. That's PHP. It's usually a 7 to 10 day program that runs 9 to 3-ish, and the person will go home every night. While at partial, individuals receive both group and individual therapy sessions, medication management if needed, and a small amount of time is set aside for tutoring each day during the school year. Partial can be used as a step down from a higher level of care or to prevent a higher level of care. Then we have our community-based acute treatment, or CBAT, and that is an intensive short-term stabilization placement provided in a staff-secure setting on a 24-hour basis. So obviously we stay there overnight. Usually, again, it's about a 7 to 10 day stay. Individuals receive therapeutic services and medication management as needed while at a CBAT. ICBAT is our intensive community-based treatment. That's for children and adolescents. They provide the same services at the CBAT, but just of a higher intensity. So more frequent medication management, more intensive staffing, and service delivery. ICBAT programs are able to admit children and adolescents with more acute symptoms than those that go to CBAT. Their programs are able to treat children and adolescents who may present similarly to those going inpatient, but are able to be cared for safely in an unlocked setting. Children and adolescents may be admitted to an ICBAT directly from the community as an alternative to inpatient. ICBAT is not used as a step-down placement following discharge from a locked 24-hour setting. So then we have our inpatient hospital. Just like it sounds, when you're sick with a physical ailment, you go into the hospital. When you're sick with a mental health issue, you also may go inpatient hospital. The difference is when you go inpatient for mental health issues, you are going into a locked unit. During your stay, you should receive individual and group therapy, medication management, and then have free time as well. Then we have our residential programs. We have group homes. Those are just regular houses that are staffed 24 hours a day. They're residential services available for children and adolescents who are unable to live at home for a variety of reasons. Youth are usually, not always, but usually still able to go to public school if it's safe for them to do so. If they're in a residential in their area, they're usually able to be bused to their school that they're used to. Sometimes they do have to transfer schools while in a group home. Intensive residential treatment, IRTP, those are locked programs for youth ages 13 to 18, offering intensive treatment. This is a place where they're going to stay 24/7. They're going to go to school on site. They're going to be offered specialized and individualized clinical services, and this is where they're going to live. Clinically intensive residential treatment program, or the CRTP, same as the IRTP. It is a locked program, just difference, youth 6 to 12. They also will live there and attend school on site. And then we have our continuing care units. These are locked psychiatric hospital units for youth needing the most intensive level of treatment available. And this is because they might be considered to be a danger to themselves or others. We call these our CCUs. So I hope you learned something. I hope you were able to kind of distinguish a little bit between inpatient, residential, group homes. And if we can help you at all with anything else, please reach out to us at ppal.net.